Once again, Donna Smith.
I'll go through them as quickly but as well as I can. Comments are great. First of all, the person who said it's a major bailout for the insurance companies, absolutely 100% agree with you, right? It's a financial industry. It is not a health industry. The health insurance companies do not provide health care. They provide a financial service. We are bailing them out with millions more customers. So yes, that's absolutely true. And thank you for the kind comments about Larry and my health. Thank God I am cancer-free. Larry is having a tougher time. So thank you for asking. Okay, the question about, here's a question saying, I'm fairly sure the Washington State Nurses Association supports single payer, at least their chair, Judy Weinberg. Any rumor of CNA joining up with them? I'm not sure I would be privy to such detailed information, but it's a wonderful rumor, isn't it? Wouldn't it be great if we had all the nurses in all the states joined together as single-payer warriors for us? I will tell you that our nurses organized, can you believe it, organized 4 hospitals in Texas last week. Yeah, come on, that's awesome stuff. So we hope so. We hope Washington will join us soon. Here's a couple of questions. Why not Medicare for everyone instead of single-payer system? That's a great question, and there are people who really believe that we should change our language to say Medicare for all instead of using the language of single-payer because I think it puts people off or it's confusing. And there's some schools of thought on both sides of that. Some people say until we really fix Medicare, it'll be a problem. Others say that, yeah, people get Medicare. So I think that will happen in the national movement, that we will move to that idea, that extending it would be far better. I say this all the time. The one day during this debate, there was one day, 24 hours literally, when this Congress considered extending Medicare to everybody 55 and over. Do you remember that? Yes. I had just turned 55 in November, and I thought, oh my God, thank you. I'm done. I'm done with this hideous system. I thought, if I felt that way, then wouldn't everybody feel that way if they knew they were done? So they're definitely, I think over the next year, you'll see the national language change to that. So good question. Another couple of questions about can any American citizen go to Cuba for care and how did we get to go? There are a couple answers to that. On the Cuban side of the question, the answer would always be yes. They would always treat any of us. They've told me that directly. They've offered very sweetly and gently to treat my husband at any time because he couldn't make the trip with me. Anytime I could get him there, they would treat him, which is pretty generous, you know, and without any cameras rolling, with nothing to be gained in a film later on. So, but the short answer is no. Right now, the American government would not allow you to do so. You could get there on, I actually went there under my own passport, obviously, and a journalistic visa, because I was a working journalist at the time, and educational visas. So Michael Moore did have the proper paperwork to get us there. And once you're there, you are allowed to seek care if you need it. So there are ways to do it, but it's quite complicated at this point. There are people who go in through other countries, but I don't know about you out there. Okay, the current full cost of society of this system the way it is. Wow. That's a huge question, isn't it? I mean, not just in the humanity loss, the 45,000 estimated, I think it's probably higher than that, people who die every year in this country because they don't lack access to appropriate medical care. I always wonder, because I'm of the age that used to watch the reports on the Vietnam War and you'd see the death toll every night. We don't do that kind of journalism anymore in this country, do we? No. What if we did every night? The number of dead from this healthcare battle. 123 every single day. It's like a jetliner going down every single day in this nation because of this issue. That would change the discussion. There's another quick story I always like to tell because I remember it so vividly. A young woman named Vanessa Beck came to the microphone in Illinois, was having a single payer hearing for their state bill, which is HB 311. And she got up and she told the story that many of our young people could tell. She had Crohn's disease, and she would work a job, have benefits, and she'd choose the job based on being able to get benefits. She'd work until she was too sick to work. Then she'd lose the job because she couldn't get to work enough, and she'd have to pay COBRA or not be able to pay it until she would qualify for Medicaid. And once she got well enough on her Medicaid benefits, the whole cycle would start again. Get a job, find a job, work the job, get sick, lose the job, the whole thing. And she stopped for a minute, this beautiful 28-year-old African-American woman, and said, I wonder what I might have become. And I thought, wow, how do you calculate that in loss to this country? How do we all calculate that? I don't know. You know, I'm 55, and I've lived a good portion of my life. 28 years old, and we're doing that to folks, so it's hard. I mean, you'd have to calculate, the nurses did a study, and this is on the positive side. They did a study of what if we extended Medicare just the way it is to everybody in this country. And you can go on the California nurses, somebody has a question later about looking at documentation. Our nurses are not all Democrats. We have nurses who are Republicans, independents, we have nurses who don't vote, although we wish they would. On the calnurses.org website, you can go to the study of what would happen if we extended Medicare to everybody, just the way it is, without improving it, even though that's what we all want. And we measured, our research department measured 26 different segments of the economy and what it would do to the economy. Not only would it not be an economy killer, it would create 2.6 million new jobs net. You'd think we'd want that in a recessionary time, wouldn't you? Think we'd want that? And the offshoot into the economy, just think about it. If fewer of us were putting so much resources into insurance companies and into a certain thing, we'd have more money to generate out into other segments of the economy. I'd be able to go take my grandkids out a little more often, get them a few more toys, do some things with local businesses a little more. It would be a really big shot in the arm.